Today is a big day for 5-year-old Max J. He's getting his cast off. It's a big deal for anyone, but it's especially big for Max. Max was born with clubfoot, a birth defect where a baby's foot is twisted inward and downward. He and his family have been working with Dr. Jared Daniel, a pediatric orthopedic surgeon at Sanford Health in Sioux Falls, South Dakota.
So it consists of having a high arch, toes that are pointing inward, what we call adductus, and then a heel that's high and also in a malalignment position called varus.
Now, Max's clubfoot was actually discovered while he was still in the womb. Dr. Daniels said finding conditions like clubfoot in utero, along with the collaboration between the obstetrics and pediatrics teams at Sanford, helps provide the best outcomes for patients like Max. The treatment plan for Max would consist of what's called the Ponseti method, which is essentially 5 to 6 separate gradual castings to correct the 4 deformities within the foot.
A lot of times you go in, you want answers as a parent and you want to fix. But this was going to be a journey that we were looking at possibly for the rest of his life.
Part of the Ponseti method is also an Achilles surgery to allow the heel to drop.
We then put him in some boots that he wore 23 hours a day out of 24 hours. And there was a metal bar that would go between his feet to try to keep that foot out so it wouldn't turn in.
Max started walking at 18 months. He began transitioning away from the Ponseti method at age 4. But due to a tendency to turn his foot inward when walking, Max would need another procedure.
And Dr. Daniel said we needed to do that procedure now because he was walking on the side of his foot and it was causing him to drag his foot and lose some of his nerve function or motor function to that foot.
The procedure would take a tendon from inside of Max's foot and reattach it to the outside of his foot, which would keep the foot straighter. However, during the procedure, Dr. Daniel saw the tendon was connected to the muscle right next to it, meaning they had to call an audible during the procedure.
And did what we call a split transfer. It's a different type of technique from that transfer, that split tibialis anterior tendon, and that allowed us to move that tendon over to the appropriate side.
The procedure took longer than predicted, but Dr. Daniel's commitment to Max never wavered.
You could, as a surgeon, just close him up and be like, oh, well, there's nothing else we can do. He has this additional anomaly. But Dr. Daniel is so caring that he was like, no, we have to think on our toes and come up with the best outcomes for Max.
In Sioux Falls, Simon Floss, Sanford Health News.